Hello, my name is Charles Posky, and I'm a nursing student here at South Alabama. Today I'll be continuing my nasogastric tube placement, and today I'm going to be doing my anemia assessment. So first I'm going to have my friend scan the room for me. While I scan the room, I'll explain that I've already verified the order, verified hospital policies. I've used my tube identifier for the patient. I've also saw an order form that they're allergic to penicillin. I'll confirm that. So first I'm going to do, I'm going to gather my equipment, perform hand hygiene, I'm going to don goggles, and then I'm going to don clean gloves. I'm going to then take my enema bag to the sink, fill it with water to 750 to 1,000 milliliters of warm water. Make sure that's clamped. I'm going to add 750 to 1,000 milliliters of warm water into the bag. Like so, and then I'm going to add soap. And then I'm going to gently agitate the bag. Next, I'm going to prime the tube and unclamp it. I'll clamp it. And then cap it. Now I'm going to put the bag onto an IV pole. Have this sitting there. Next, I'm going to raise the bed, lower the side rails, and I'm going to position the patient to a left lateral SIMS. After that, I'm going to then grab the tube with my dominant hand, and then with my non-dominant hand, I'm going to lubricate the 3 to 4 inches of the tube. I'm also then going to use my non-dominant hand and place my hand on their hip firmly but gently and explain the procedures to the patient. I'm then going to insert the tubing through, and then I'm going to then use my non-dominant hand and I'm going to lift up on their butt cheek, and then I'm going to insert it to 3 to 4 inches. If the patient has hemorrhoids, I'm going to have the patient bear down for me to on the insertion to facilitate the process of the procedure. And then now I'm going to keep my hand onto the tube, onto the rectum, and I'm going to lift up the bag, and I'm going to hold it to 12 to 18 inches and have my bedpan beside me at all times. I'm also going to then now start to unclamp it to release the water. As the bag's emptying, if the patient is having any problems, I'm going to lower the solution or reclamp the bag and instruct the patient to start breathing normally again. Deep breaths if they're cramping or feeling uncomfortable. So once the bag's emptied, I'm going to discard it, and I'm going to have the patient hold to the enema for 10 to 15 minutes. Okay, now I'm going to reclamp my bag. I'm going to gently pull it out, discard it, have the patient hold on to the enema for 10 to 15 minutes, and then I'm going to assist the patient onto a bedpan or to a bedside commode or to the commode to evacuate. I'm now going to show you the different bedpans to use. For this one, it's for patients, they just sit on this far side right here and then pee into this direction. And then for this one, this bedpan's for patients that are having a fractured leg, or they're not very mobile with their legs, so it's easier for them to pee into. So they're going to sit onto this area right here and have the handle pointing out towards their legs. After that, I'm going to document the procedure. I'm going to document the type of enema, time, how they tolerated it. I'm also going to document the color and the amount of that was returned, and then I'm also going to document how the patient was left after the assessment, and that would be it.